Alors, le but de cette conférence pour nous à l'AFD est de réunir l'ensemble des experts du monde entier pour évoquer le problème des personnes âgées et de la santé bucco-dentaire. Aujourd'hui, c'est un problème extrêmement important qui est méconnu. Donc notre objectif pendant ces 2 jours est de faire le point sur la situation de la santé bucco-dentaire dans le monde, en particulier de la santé bucco-dentaire des personnes âgées.
So through FDI, I would like to dispatch the importance of oral health to the people. 2 things. One thing is how to approach to the authorities. They have to understand the importance of oral health in aging society. Second point is how to dispatch our very valuable information to the people.
I'm very much looking forward to continue to have this partnership with FDI, and also the outcome of this meeting is very important to implement the policy for geriatric population, so it is very much important.
And surveillance and monitoring are necessary for making policy, especially health policy and a strategy.
Well, elderly people are facing a lot of challenges that are either related to physiological aging, so impaired vision, impaired dexterity, impaired tactility, and along with that, the prevalence of morbidity and of multiple chronic diseases increases with age. And together they face a lot of problems in terms of maintaining our hygiene, and with that they risk, of course, developing periodontal disease, caries, and finally tooth loss.
Some other of the challenges have to do with the increased frailty that they experience. It's much more difficult for them to be transported to a dental office. Oftentimes they need to find alternative methods of care in terms of mobile dentistry, and finding access to those types of providers can be challenging and expensive.
When working with older adults, it's really important to take a life course approach so that you provide appropriate treatment. What a life course approach means is that all of us age differently, and all of us have different levels of well-being, different levels of chronic disease, and different functional capacity. So if we are able to take care of ourselves, we're fit, and we don't have any chronic disease, well then providing oral care can be routine and just like you would for a younger adult. However, once chronic disease starts happening in older years, even if it's well managed, it can have an effect on oral health. So we have to take this life course approach so that we provide appropriate prevention and treatment for every stage of aging.
There is association, and that is really clear between the severe periodontitis and such diseases, such heart disease, atherosclerosis and diabetes. The connection is not clear. It's not clear whether it is causal or it's just coincidental, because there are many common risk factors, and the nature of such studies makes it very difficult to really prove the causal relationship.
So WHO oral health, we need to strengthen the importance of oral health promotion and also disease prevention, especially targeting for this elderly population. So in this sense, we need to emphasize the integration, the oral health and general health.